Namaste, I am Srijana Dahal and I am here to talk about X factors to battle with COVID-19. COVID-19 is an infectious disease transmitted through droplets generated when an infected person coughs, sneezes, or exhales. Touching a contaminated surface and then your eyes, nose, or mouth, or having a close proximity of someone who has COVID-19 transmits this virus. It was first reported in Wuhan, China, and WHO declared this as a pandemic on 30th January 2020. There are 6.93 million infected cases worldwide and more than 4 lakhs people have died. Measures like social distancing and isolation have been proven to be effective for controlling its spread. Wearing masks, maintaining personal hygiene, doing tests, and staying quarantined are being done to lessen its spread. Research are being done about the cure of the disease. Countries like Japan, Nepal, and India have declared lockdown to decrease its spread, but countries like US, Sweden, and South Korea have not. And apparently, US has a number of cases rising while South Korea controlled it with aggressive testing. Now let's talk about the problems we are facing. There are sick people and asymptomatic, the ones who don't show any symptoms. There are poor and insufficient ICU and ventilator facilities for the sick ones. The doctors and medical health workers are not secure. Healthcare system is overwhelmed due to the rising number of cases. The quarantine facilities are worse and people are suffering a lot. Dead body management is also being a problem. The asymptomatic ones are dealing with lockdown and the problems generated by it. Though lockdown reduces the number of spread of the virus, people are suffering with depression, anxiety, and suicidal rates are increasing. The economy is crashing down. Poverty, hunger, domestic violence, and unemployment rates are increasing. Migrant workers, laborers, and wage workers are at a great trouble. Lockdown should be used effectively to get prepared to deal with the rising number of cases. At least 60 lakhs people are said to have been jobless due to the pandemic, and we don't know for sure how long it might take to rebuild the economy. So, to deal with the problems, labs for tests have to be set up rather than extending the lockdown. Test kits have to be purchased, and the most vulnerable children, elderly, and people with multiple chronic diseases should be protected and tested. Pool testing can be done to better utilize the resources. Quality of quarantine facilities should be improved. Detailed data collection should be done and social stigma related to coronavirus should be minimized. Public health should be promoted and awareness should be provided. ICU, ventilator, and good healthcare facilities must be provided to the sick ones so that the healthcare system can sustain and treat them. Psychological, mental support should be provided through online program, and engaging activities like this should be encouraged. People should be insisted to meditate, read, learn new skills, exercise, and stay away from negativity. Any sort of violence and crime should be discouraged and justice should be provided to all. Talking about economy, markets have suffered losses unseen since the 2008 financial crisis. So coordinated, decisive, and innovative policy from the world's leading economy should be made. New business models should be created and government should provide subsidies. Domestic production has to be encouraged while taking the advantage of reduced imports. This is an opportunity to rebuild ourselves much stronger. This is a difficult time and only one effort is not sufficient. Every life matters equally and saving them cannot wait. Let's get united and contribute from each one of our sides. A global pandemic requires a global response. Thank you.